My name is Mahmoud Razavi. I am the Director of Clinical Trials at the St. Joseph Heart and Vascular Institute in Orange County, California. Well, the VIVID trial was a pivotal study looking at the DUO Venous Stent System in patients with iliofemoral venous obstruction, non-malignant iliofemoral venous obstruction. So as such, this study was conducted to look at the efficacy and the complications, basically safety and efficacy of the device. One may ask, well, does the world need another venous stent? There are complexities of the anatomy of the iliofemoral venous segments that pose a challenge in terms of requirements for a stent. In one end of the segment, under the where there's common iliac vein compression, you need crush resistance, and then if there's post-thrombotic disease in the remainder, you need flexibility and radial force. Therefore, it would be nice to have a single platform that accomplishes all of those in one stent, and that was the objective of the DUO Venous Stent System. The stent is, there are two different stents in the platform. One is the DUO stent, which is called the hybrid, and as the name implies, it is a hybrid system where at one end there's high crush resistance, at the other end there is flexibility and radial force. And then the second stent is called DUO Extend, and that is designed for extension at the caudal end or sometimes cephalad end, if that needs to be for optimum coverage of the lesion. So this was a single-arm study. It's a prospective multicenter single-arm study. It was 9-blinded. 162 subjects were enrolled in the U.S. and in Europe. And the primary safety and efficacy endpoints were very similar to other pivotal trials. The primary safety endpoint included freedom from major adverse events, which was adjudicated by a clinical events committee or core lab at 30 days. The primary efficacy endpoint was primary patency of the stented segment at 12 months, which was defined as core lab adjudicated patency, which means less than 50% obstruction or occlusion or reintervention. This was a very typical patient population enrolled in this study. As with these types of patients, the age range was not that old. It was about 60 years old. Majority were male, about 63%. That was different than some of the other trials. And the majority of the patients, about 85%, the symptoms were greater than 14 days. The breakup of three disease states was about 10% of these patients had acute DVT, and the patient was enrolled after the clot was successfully removed. 26% of the patients had post-thrombotic syndrome. That means patients with history of DVT, scarring, or occlusion of the iliofemoral segments. And then the remainder were the non-thrombotic variety of patients. The target limb majority, close to 80%, were on the left side, and that's where it's common for iliac vein compression. And the post-intervention stenosis, interesting, there's only about 6%, which speaks to the mechanical properties of the device. The results were compared to a literature-derived performance goal for freedom from major adverse events, which was the primary safety endpoint. The performance goal was around 89%. So there had to be 89% freedom from the major adverse events. In this study, that number was 98.7%. So that's obviously a statistically significant improvement over the performance goal. Same as efficacy, the 12 months primary patency efficacy, which was weighted depending on how many patients in each disease category were enrolled. The performance goal was 77%, and in this study, the patency rate was 90.2%, which was obviously significantly better than the performance goal. So therefore, both primary endpoints were met. Obviously, the clear take-home message initially is that both primary endpoints were met. Now, the studies, the results are being evaluated by the FDA for approval. So the device is not yet approved by the FDA. But since the primary endpoints were met, the chances are that the device will get approved. So the issue is going to be then, given that there are other stent platforms are available in the market, when one would use to choose either the DUO hybrid or DUO extend. And I think there's definitely a need for these stents in the market based on the physical characteristics that we described. Well, as these things go with the FDA, these patients are followed at 2 and 3 years. The next step is presentation of quality of life data, which were secondary endpoints in this study, and that will be presented at the American Venous Forum coming up in March.